Hi everybody, Dr. Khan here with City Fertility, and today I just wanted to do a really quick talk about Polycystic Ovarian Syndrome, or PCOS. This is a tough one. It's a tough one for patients, it's a tough one for providers, it's a tough one for everybody. And there's so many reasons for that. So let me just kind of talk a little bit about what we know, and then we can talk a little bit about what we don't know, and we sort of go from there. So traditionally, the diagnosis of PCOS is made by a patient having two of the following three features. One is irregular anovulation or irregular cycles, irregular periods. Another one is the appearance of multiple cysts on the ovary on ultrasound, or a polycystic appearance of the ovary. Usually that's going to be more than maybe 12 per ovary, and there's a characteristic feature of really having multiple follicles around the periphery of the ovary that's a little bit more consistent with a PCOS phenomenon, clustering in that location. And the last one is evidence of elevated androgens or elevated male hormones. That can either be from blood tests or that can be clinically. For example, having a lot of excess maybe facial hair, or male pattern baldness is one that we see sometimes. Body hair in more of like a male distribution pattern. So that's that third feature. And so having any two of those three is usually what is required to make the diagnosis. So that in and of itself is a little bit confusing, because that means that to make the diagnosis, you can have a different constellation of features. So it actually makes the sort of whole catchment of PCOS very broad. I almost like to think about it as being on a spectrum, because sometimes patients won't meet the technical diagnosis. They won't have two of those three features. They'll have one, or sort of have one, or 1.5. And so I really think that it's a little bit of a spectrum, because even when maybe we don't meet the complete diagnosis, there are going to be other features that really are indicative of maybe having polycystic ovarian syndrome, like for example an elevated AMH is sometimes found. So it's good to have an idea about that for a lot of different reasons. So it's good to really have an idea about polycystic ovarian syndrome, because anytime anybody is having irregular cycles or missing ovulation, the concern is just that there is the development of a hormonal imbalance, in that the beginning part of the cycle is normal, the estrogen goes up, but without ovulation, you don't then have a rise in progesterone, and so then you don't have that normal balance of estrogen and progesterone. And over time, that can become dangerous. So people who skip cycles and don't have any ovulations for many years may be at increased risk for breast cancer or endometrial cancer, things that may be associated with unexposed estrogen. So it's really important to confirm a diagnosis and to be really proactive in terms of getting a progestogen replacement on board for people that are at risk. So that's just a little bit about the diagnosis and kind of how I think about it. I get a lot of questions for why do I have polycystic ovarian syndrome? And that is a really tough one, because the truth is we don't know. There are so many theories about genetic underpinnings, about there potentially being environmental factors. We hear a lot of things being thrown around in terms of excess of certain hormones or effects of birth control pills is one that I've heard. But the truth is I just don't think we really know. We don't have it all figured out. And so when we find a patient that has some of these features, it really becomes a question of trying to manage things correctly. Management often really involves trying to assist with fertility, and a big part of that is helping to establish ovulation again. And then replacing progesterone or replacing a progestogen is another big part of that, just to try to normalize some of those hormones, and then especially protect from some of the late stage features that we can sometimes see. Another really important thing to consider with PCOS is its association with a metabolic syndrome. So for a subset of patients, they may be more likely to have elevated blood pressure, elevated blood sugar, high cholesterol. And so for those people, it's really important to really kind of screen and make sure that there isn't any high insulin issues going on that really could contribute to the formation of diabetes or some of those other metabolic problems. We want to be aware of that as early as possible, and then try to really manage and treat what we can. So just a tiny little snippet about PCOS there. It's such a complicated disease entity, and I feel like we can sort of learn about it all the time, but hopefully we can really translate that into more functional help for people. As always, I value opinions, I value questions, so if there's anything that anybody wants clarification on, feel free to drop us a line. Of course, if you have ideas for future topics, absolutely let us know. Otherwise, thanks so much for watching, and we'll see you next time.